But I want to talk about some of the other ills of being a PPO-oriented practice. Some of the other ills. PPO plans are on a mission to commoditize dentistry. To Delta, or I'm using Delta. I'll continue to use Delta in this example because they are the 5,000-pound gorilla. They're the bully in the room.
Yes.
There's other offenders, but Delta gets the cake. In Delta's mind, crown's a crown's a crown's a crown's a crown. And we know better than that, don't we, Naren?
Yes.
Are they the same?
They are not the same. I mean,
They're not the same.
Dentistry is something that dentists get into because A, they want to make a difference in people's lives, and B, they like medicine. They want to do amazing work. So when they say it's a commodity, I mean, it's like taking one of the best professions in the world, the top 2% when it comes to look at profession and say, oh, it's a commodity. I mean, it doesn't make any sense.
It is offensive. It's an insult.
Yes.
Think about it for just a minute. I think it's safe to say any of our listeners of the Thriving Dentist Show are passionate about learning, or they wouldn't be listening to the podcast.
100%.
And as a result of that, they likely take a many times multiple of the hours of CE that are required to keep your license.
Absolutely.
Some of our clients, will take 10, 12, 15 times the amount of CE. Like for example, in Arizona, 32 hours of CE are required every 2 years. So if you annualize that, that's 16 hours a year. And we have clients in Arizona that are taking 250 hours of CE. Now run the math on that. I think that's a 15x, isn't it, Aaron?
That is a 15x. I mean, that's and I think, a lot of dentists have a long career, right? I mean, they're practicing 30, 40 years. The reason they do that is they love what they do. They love the team. They love the work they do. So if it's how can you enjoy commodities? I mean, imagine if you are just getting up in the morning and folding, sheets like 30 years, it's hard to enjoy it, right? I mean, nobody will do that. Everybody will say, oh, enough, I'm going and doing something.
Like the only restaurant you ever go to is a McDonald's hamburger.
Yes.
It's a commodity.
It's a commodity, yeah.
If a dentist is taking 12 to 15 times the amount of CE, and imagine that was, over a 10-year period of time,
yes.
We're now talking about, many, 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 many times the amount of CE. It's fair to say that their clinical result is going to be different.
Even technology, right?
Well, let's go to technology, because there are offices that are the shelves are bare when it comes to technology. They literally have no technology. And then many of our listeners, of course, will be nerds like you and I, Naren, and love technology. And they'll have perhaps CAD/CAM dentistry. They'll have lasers. They'll have 3D cone beam imaging, 3D CBCT. They'll have digital printers these days and are exploring the envelopes of what they can do with digital printers in their practice. And again, is the end result the same for the dental office that is completely barren of technology versus someone that is state of the art when it comes to technology? Think about our team members. Are team members commodities? Absolutely not. I've had the privilege of being at over 2,200 practices as a coach over the years. And one of the things that characterizes a thriving practice is that they've got exceptional team members who are paid very well.
Yes.
They don't have a constant turnover of team members because they pay their team members. They invest in their team members. They invest in their education. They invest in improving them, and they attract and keep the best team. And that provides a different experience for the patient when they come in. Again, destroying the myth that dentistry is a commodity. Think about that. Another ill of a PPO plan is that everything about a PPO model practice takes you away from being relationship driven with your patients, because you're forced to pedal so fast, kind of like the proverbial hamster on the wheel. You're forced to pedal so fast that you can't really slow down and get to know your patients. Yesterday I had a conversation with a young dentist, and she said, Gary, I'm getting really tired of feeling like, in the morning, I've got to strap on roller skates to my feet because I know my team is going to shoosh me up and down the hall. And And I made the comment, I said, does it ever feel like you've got rocket boosters on the back of your roller skates? She said, today was one of those days. And everything about being a PPO practice takes you away from being relationship driven, because you don't have time. You don't have time to slow down and get to know your patients.
I think this title, "Are you working too hard for too little?" kind of all the points you're giving right now, Gary. It's just it's all real examples of real clients who were PPO one time, and that's how they felt.